Hey class, in this video we are going to talk about headache. Headache refers to a pain that's in the head or in the upper neck. The upper neck actually refers to the occiput region, so that's still in the head. It is a very common disease in our daily practice, and many people, they may have experienced headache in certain time of their life. From conventional medicine point of view, headache can be divided into primary headache and a secondary headache. The primary headache, it is very difficult to identify the actual cause according to the theory or the medical level today. So the actual cause of these headaches still unclear. The patient will present as headache, either cluster headache, migraine, tension headache, or sometimes the patient will tell you stress related, etc. But when we see a patient present with headaches, it is very important for us to exclude secondary headaches or to identify the secondary headaches, because the treatment principles will be very different from the primary headaches. For the primary headaches, the treatment will focus on the headache itself. So we're going to focus on how to relieve the headache. But from the secondary headaches, apart from relieving the pain, we need to identify the actual cause. We need to do something to relieve or to treat the actual cause, the potential cause, and then this is the only way it can prevent it happens. So what are secondary headaches? A secondary headache refers to a symptom of a disease. This is different from the primary headache. The primary headaches, as I mentioned previously, the headache, the actual cause is unclear. So we don't know why this patient presents as, for example, the migraine, although there are many different theories that can explain, but that's all possible. These theories is not the actual cause. But from the secondary headaches, we actually can find the disease. For example, a patient presents with hypertension, high blood pressure, 190/120, and then the patient presents as headache. So you can see the actual disease. Or another patient presents with fever, runny nose, and headache in the meantime. The patient suffers from common cold or flu. This is we can see the disease headache. The headache is only a symptom of the disease. So the common possible causes of the secondary headaches: sinusitis, artery tears, blood clots in the brain. So this will result in stroke, tumor, concussion, dental problems, ear infections, inflammation in the brain, hypertension, flu, and other febrile illness or stroke. The stroke we have already introduced. The patient may present as headache. This headache always also severe headache. Hypertension, the patient also may present as headache, and some typical symptoms, some typical characteristic of this headache, the patient may feel kinds of throbbing. Flu, which is everyone must have the experience of flu, so you may know what kinds of sensation the headache during the flu. Here is very important, the tumor or cancer. So after the treatments, or if the patient presents as headache for quite a long time, and then the headache becomes worse and worse, or the onset of the headache become more frequent, especially after a long time, you need to send the patient for the examination to exclude tumor, because this is also very similar to the previous discussion in the previous videos. For stroke, patient presents as headache or hemiplegia. If due to tumor, the treatment will be very different, so we should not misdiagnose or delay the treatment. So if the symptoms become worse or more frequent with unexplained reason, so you don't know why the symptoms become worse. And also sometimes you can combine with the facial complexion, the observation from the facial complexion. If you suspect the tumor, you need to send the patient for the examination to exclude the tumor. Until now, you should already understand the etiology in Chinese medicine. We always think about something from exterior and interior, exogenous pathogens, and endogenous factors. No matter what kinds of factors, they may result in the blockage of qi and blood in the head, or malnourishment. So once the blockage, once the lack of nourishment, may result in headache, because there are many different types and possible causes of headache from conventional medicine point of view. But our treatments, when we treat headache, we don't base on those theories. So we don't introduce in details. You're more than welcome to read some information on the headache from conventional medicine point of view. And then the treatment or surgeon differentiation from acupuncture, we're going to focus on the meridians. So the surgeon differentiation, firstly, what kinds of manifestation we consider as headache? The patient must present as pain in the head. The nature of the pain may be different, either dull pain, distending pain, stabbing pain, or other kinds of pain in the head region. It may be part of the head in some region, in one or multiple regions, or the whole head. So the sensation is very important for our diagnosis. A dull pain may especially a dull pain with chronic presentation. So this patient has been suffering from headache for quite a long time and presents as a dull pain. Then we may suspect that this patient may suffer from deficiency. Distending pain, it can be stagnation. Stabbing pain can be blasphenosis. Apart from the 8 principles, the differentiation on qi and blood, exterior or interior, or the fluid, qi, blood, fluid differentiation, we also need to differentiate from the meridians, such as the Yangmi headache, Shaoyang headache, Taiyang headache, Jueyin headache, and headache in the entire head. These headaches we have introduced from the basic theory. So from the first year, we have introduced some terms of Yangmi headache, why we diagnose this patient as Yangmi headache. That's from the presentation. The location where the patient feel pain. Yangmi headache, mainly in the forehead. Shaoyang headache is mainly on either side of the head. So the migraine is at most of the migraine is Shaoyang headache. Taiyang headache in the occiput region or the upper neck. It can be the pain or the stiffness. Jueyin headache is on top of the head. Sometimes it is very difficult for the patient to identify which area they just feel the whole head. So in this situation, you can differentiate from qi and blood. The treatment principles, we will focus on the qi and blood circulation, activating, or malnourishment. For activating qi and blood circulation, we use acupuncture, reinforcing or reducing according to the syndrome. We will use the local points and distal points. So these are the most common principles that we can apply. The combination of local and distal, Yang headache, actual HN3, U23, GB14. GB14 we have introduced in the practicals. Especially the patient suffer from severe Yang headache. You can insert a few needles in GB14. Brother 2 through actual HM4 and Sanjiao 23. Large intestine 4, summer 44. So most of them are local points, and you can use large intestine 4 to activate the circulation. Stomach 4, this is the Yang meridian. The Yang is the foot Yang meridian. The foot Yang meridian of stomach. Stomach 44 can reduce the heat in the Yang meridian. Shaoyang headache. The patient presents with Shaoyang headache on the side, such as the migraine. Actual HM5, Sanjiao 23, Sanjiao 20, GB8, GB20, Sanjiao 5, GB41. These are also some, most of them are local points. Some of them you can insert oblique or even horizontal. Some of them you also can use through-in needle. So use one needle for multiple points. For example, you can use Sanjiao 23 through GB points. Those are a few points on the sides of the head. GB points, GB8. Those are 4 points. So you can insert from Sanjiao 23 all the way to the other points to GB. Payan headache. Brother 10, GB20, Sanjiao 3, Brother 62, Brother 60. Sanjiao 3 and Brother 62, Brother 60, these three are the distal points. Drain headache, Do20, Brother 7, Liver 3, Liver 2, Kidney 3, Kidney 1. Drain is the liver meridian, the liver organ. So not the meridian, it's the organ, the liver. So liver 3, liver 2 can assist. The kidney and the liver are from the same source. So we can use kidney to tonify the liver. For this group of prescriptions, what you need to memorize is firstly the local points. These are quite easy. Even the points not on the list you can use as long as they're local. But what you need to memorize is the distal points. Sanjiao 5, GB41. Brother 62, Brother 60, kidney, liver, these distal points. The headache in the whole head. U20, HN3, HN5, stomach 8, GB14, large intestine 4, GB20, Sanjiao 5. So these are the points that you can consider. Apart from the location, we're also going to identify from the causes. For example, due to wind, especially for the flu. The wind is one of the most common cause for flu or common cold. So we can use GB20, rather 12. We have introduced quite a few times for feng. F-E-N-G. Feng means the wind. Feng Ci, GB20, the pull of the wind. Rather 12, Feng Meng, the gate of the wind, of the wind, with the I-N-D. Okay. So wind cold, wind heat, or wind damp. We can use 14. Due to wind cold, we can use Moxibustion. Due to wind heat, we can use large intestine 11. We also can use 14, but if we use 14, it's a reducing technique, or even to prick to cause bleeding. Due to wind dampness, we can use GB20 blood 12 plus spring 6 with reducing technique. Due to phlegm, stomach 40, we have emphasized quite a few times. Stomach 40 is very important to clear the phlegm, no matter the visible phlegm or invisible phlegm. We can use stomach 40, stomach 36 to tonify the spleen. Due to qi stagnation and blood stasis, large intestine 4, liver 3. So these 4 points on both sides. So 2 points, actually 4 points on both sides. This is a pair I want you to memorize for qi stagnation and blood stasis to activate the qi and blood circulation. So no matter what kind of causes, as long as the patient presents as qi stagnation, then you can use liver 4 and large intestine 4 and liver 3. For example, another patient presents as bad temper, irritation, then you can use these points as well. Especially, it's more suitable if this patient presents as irritation and headache. Then you can use large intestine 4 and liver 3. You also can add bladder 17. Bladder 17 is the meeting point of the blood stasis. So you're going to use bladder 17 to assist the blood problem. Due to qi and blood deficiency, you can use room 6, room 10, stomach 36. That's from the stomach 36 is from the source of spleen and stomach, the middle jaw. Spleen 10 due to blood deficiency. The sea of blood from the name, 血海. So it can tonify the blood. When we study the points or the prescriptions, especially from the lectures, what's important listening to the lectures is you need to understand or try to memorize how I explain the function of each single point. Due to hyperactive liver yang, same as J-in headache. The reason why same as J-in headache, because J-in headache, when we talk about J-in headache, it is actually refers to the liver. The liver, mostly the hyperactive liver yang, or liver fire. Although liver fire and liver yang, these two are slightly different, but no matter hyperactive liver yang or liver fire, one's deficiency, one's excess, but no matter deficiency or excess, the patient presents as heat. So the local points we can use the same local points, but in the meantime, we will treat the cause due to liver insufficiency then you can use the liver points with the kidney points. If due to excess, then you can use also the level 3 but you use the reducing technique. You also can use R4 points, so the local points. Needle technique. Most of the points on the head we have practiced in our particles. So you should already know how to insert the points. Most of the points on the head or on the face, you can insert horizontally because the skin is quite superficial. And then some of these points can be inserted perpendicularly, but we need to pay attention to GP20. All the points that's around GP20. So we have insert 5 needles there. 腕骨, 分尺 GP20, 分腹, and then on the other side. So these 5 points, you need to be careful about the direction and the depth. The manipulation techniques, we need to select specific technique according to the course. Wrinkle, phlegm, qi stagnation. So either excess or deficiency. For excess, you're going to use reducing technique. For deficiency, we're going to use reinforcing technique. The frequency is very important. For acute headaches, you can choose once a day or even twice a day. Keep the treatment for 30 minutes to 1 hour, even longer. For chronic headache, you can treat the patient once a day or once every second day. So the frequency is very important. Why sometimes the patient may recover, or sometimes you don't see them much good results. That's because once the points you select, the second is the needle techniques. The third is the frequency. The frequency is very important. This is very similar to the dosage in tablets. In order to achieve the efficacy, we need to maintain certain dosage of acupuncture. This is the frequency, as well as the duration. Don't treat the patient only for 10 minutes or a few minutes. You must leave for 30 minutes or even longer. The reason why we keep 30 minutes for many diseases, I'm not sure if we have introduced in the videos or not, but we might have already introduced in the lecture, in the contact classes. 30 minutes, that's because from the theory in Nanjing. Nanjing, it described as the circulation of qi and blood, the circulation 25 times during the day and 25 times during the night. So which means the qi and blood circulation in the body is 50 times per day. So it's about 24 hours. When we divide 50 times, it will be about 28 minutes, 28.8 minutes per cycle. So we want to keep for one circulation, one full cycle of the qi and blood circulation. That's why we use 30 minutes. One cycle will be 28.8, just more or less 28.8 minutes. So we keep for one cycle. It depends on the situation. If it is needed, we can keep even longer. For example, for stroke. In the next few videos, we will talk about the myocardial infarction, the heart attack. You also can keep longer. So it all depends on the situation. Other treatments, skin needle technique, 3-edge needle. So we can especially for severe headache, you can prick to cause bleeding. Electrical acupuncture. Electrical stimulation can always be applied during headache after the qi. Auricular acupuncture. For headache, it is very important to identify the causes if we can. For example, hypertension. If you see a patient presents as headache and then you realize that this patient presents as hypertension, it is very important to reduce the blood pressure. To reduce the blood pressure, you can send the patient to the general practitioners to take the tablets, or if you want to use acupuncture, then you can use, but that's the potential cause of the disease. As I have to say that for some diseases, especially for the secondary headaches, for some diseases, we will recommend to use tablets to control or to maintain those diseases. Because although acupuncture can reduce or to relieve the symptom quite quick, but how long does the treatment last? We need to doubt that, especially for secondary headaches. That's why it is very important to identify the cause. For example, a patient suffers from severe headache due to stroke or severe headache due to brain tumor. Although we can eliminate the pain, but it is very important to exclude, treat the disease. For example, the tumor. We will never be able to heal the headache with acupuncture if this headache is due to tumor. So we need to suggest the patient to seek for further treatments or further advice from other practitioners or other specialists. In conclusion, it is very important to identify the causes of the headache. Headache is very common in our practice. It is very important for us to understand the definition, the differentiation, how to differentiate different types or different subtypes of headache, the prescriptions of each subtypes, and the management. Thank you for your attention.